Okay, I think we're going to get ready to start. I want to welcome everybody to the first webinar for the American Society of Addiction Nursing for 2023. This webinar has been approved for one nursing CE through the California Board of Nursing. Complete the survey, which will be sent to you by email at the completion of the webinar, so you can get that CE. And a certificate of completion with CE will be sent to you by email with verification that the survey has been completed. All sessions will be recorded and archived on the website. A CE is available if you will receive your certification after completing the survey after you watch the webinar. And all webinars are free to ASAN members. So if you miss a live one, you can go in and see the archived version. Please keep your cameras on, but mute your microphone. We don't want to hear any dogs barking. If you have questions that come up, please post them in the chat box, and then Donna will answer them at the end of her talk. Today's webinar is called Learning to Care for Myself When Every Day is Stressful. Do I have PPE to sustain resilience? The objectives are to describe the patterns of stress in their lives, describe 3 mindfulness techniques as instructed in the educational program, employ several techniques to utilize in everyday life that will promote a holistic approach towards self-stress relief. So Donna was an addiction specialist for the Lemuel Shattuck Hospital, a public hospital in Commonwealth of Massachusetts. She's the former chief operating officer and nurse executive at Worcester State Hospital. In addition, she was the director of nurses and the director of chemical dependency services and the dual diagnosis program at Pembroke Psych Hospital. In September, Donna assumed the director position of the University of Massachusetts Boston Alcohol Counseling Education Program. She is the recipient of the Massachusetts Education Educator of the Year. But Donna thinks the most important thing she does is working with nurses in recovery for the Mass Nurses Association. Donna, take it away.
All right. Good. I'm glad you didn't read the rest of it, Suzanne. We'd be here for a while. Okay. So tonight, the reason I asked you to put your questions in the chat box is so that we can get through it. As I said to the people before we even started, I could talk for days on this because it's such an important topic. And I'll tell you how I even got into it years ago. I mean, it just was so crazy. When I was the head of a hospital, what I saw was people changing. I mean, for lack of a better word, the more I studied it, the more I realized it's called transformational worldview. And that's when you see people actually change. They're transforming right in front of you. So the people that I loved, that I actually worked with, I couldn't understand what was happening to them. And they were becoming grouchy and snarky and irritable towards patients, et cetera, clients. So I began to study it. And the reason how it all came about is I was talking to a psychologist one day that I worked with, and I said, "What's happening here?" And I don't want to say threw the book at me, and it's back here somewhere. This is my to-do list back here. And it's a very small book. And he said, "Read this." And it's called Compassion Fatigue. And I said, "Oh, this is it." The author of the book is Charles Figley. Charles Figley is a Marine combat veteran from Vietnam, came back, became a psychologist, and wrote about PTSD when it was just forming. And no one really knew what it was. World War II, it was shell shock and all of that. They had all sorts of names, combat fatigue. And Charles Figley studied all of us in healthcare. And he saw this, it's called transformational worldview. And what he did is he took it and retooled it into PTSD, into secondary traumatic stress, into combat sort of type compassion fatigue. And that's us. We face it every day and we don't take care of ourselves. The bottom line message is we're just not good at taking care of ourselves. We're fabulous at taking care of other people and telling other people how to take care of themselves. But we're not really the profession that knows how to take care of ourselves. I'm just going to run through these. You take a look at this. I want you to think about why you do this work. How did you learn to be? I mean, I work with all different professions. So what is it that drew you to this type of work? I can tell you 90% of the people that I work with that are nurses either had it modeled for them, there's a nurse in the family, or they early on wanted to be because caregiving was in their bones, their blood, and in their family. I've only had a handful of people that would ever say, I would never do this again. Most often people want to change the stress, but they would always choose their work again. Think of what your average day is like. How stressful is it? Where's my Julianne Mazzoui? Where is Professor Mazzoui? I know you're on here. We just said hi. Think about your day, Julianne. What's it like? What do you have, 150 students in a class? I mean, just think about the stress that we all do. I work with young nurses. I just met them at Mass General Institute yesterday, and they're bright-eyed and they're so excited. And then I have a picture of what they will face, especially what we looked at in COVID. And I didn't put it in here. There's like 12 machines in one room. And you don't want to sort of blunt that enthusiasm, but how do you teach them to balance and take care of themselves? Actually, the Generation Y, Zs, Xs, and the millennials, they're better at taking care of themselves than the rest of us. It's the only time really in healthcare, this is another lecture, that we have 5 different age brackets all working together. So there's stress in that too. What's your greatest stressor? Just think about it. What makes you care so much? We've got this great profession. I have 3 daughters, not one nurse in the family. And I used to say to them, doesn't anybody really want to be a nurse? I never did. My mother wanted me to be a nurse. And when I would say to my kids, anybody really ever want to be a nurse? And my oldest one, the redhead, said, oh, sure, Ma. I can't wait to work days, evenings, weekends, nights, and every holiday, like watching you grow up. No thanks. And yet, would we change it? Sure, we'd love every holiday off, but we know we're there for patients. We tolerate aberrant behavior. Well, what's that about? Sometimes that's even patients. The aberrant behavior can be us. It can be each other, towards each other. We handle daily crisis every day, don't you? I mean, I have all these great stories. If we had more time with, mothers who are nurses, fathers who are nurses, we don't worry until there's gross blood happening. So a crisis to us is different from a crisis to people who are not in healthcare. We have emotionally draining and physically difficult work. What we do is called psychic numbing. We sort of shut it off. Emergency department staff are great for this. They have to. They have to employ psychic numbing. It's what Dr. Figley talks about in his books and his research. If they don't employ psychic numbing, many of us do that. But they were the first group studied in 1991 by a nurse. And the Figleys, he's married a woman. They both do research. Now think about that. If you work in the emergency department, you get kids, and a little 7-year-old comes in on that stretcher. If you identify so much, you can't do your job. So you have to employ the psychic numbing, and it's called shelving. What do you do next? You take your emotions and you put it on the shelf. What can happen to you on your way home is called flooding. It just hits you. So you got paperwork and responsibility up to your ears. Do you get paid a lot? You might be getting a better salary now than we used to as nurses years ago. Beginning to wish I was a traveling nurse. Every day in your life, this is what you do. And I think the last line is the most important because we meet the needs of other people. So these are the issues that we face. Loss of therapeutic realism. You know what that means? How much can you really do in an 8-hour day? I have to consult to a hospital for the next 6 months, go out there every 2 weeks because they're faced with how much can they do? And the nurses are just feeling stretched and pulled. Some of it's staffing, but some of it's the reaction to stress. We can get into self-neglect. What does that mean? You start a job, renew, you're enthusiastic, you're excited. 6 months later, you're showing up looking like Scruffy the cat. You don't know what is happening to you. You don't care. Things are different for you. And people notice. That timeline is different for everyone. Caregiving is based on empathy and caring for humanity. We have great reverence for humanity. We believe in doing the right thing. We have respect. Do you find any of that changing in you? Just think and have to answer. Moral distress is when there's a struggle in your heart and your mind, your belief systems. It's just all coming at you. You know this is the right thing, and yet I have to do this, and I have to not give the extra that I could give to a patient because I have 8 patients to take care of. And the 8 on a unit today might have been in an ICU 10 years ago. So we deal with so much. 10 more minutes, I'll have you thoroughly depressed. You'll be wondering, is this going to get any better? This is what we do, guys. We deal with so much constant giving. Aren't you head nurse of the neighborhood? Doesn't everybody call you for everything constantly? I know one time where I worked on the street, rather, a woman called me and she said, my daughter's in labor. Can you come over? What? I work in psych and addictions. I said, call somebody who knows what they're doing, not me. But we are viewed as the person to call. That non-interaction with others, what happens is we can shut down. We just want to pull back. Have you ever sat in front of the TV at night? You're just sitting there and someone walks by in your family. Hey, what are you watching? And you say, I have no idea. Do you know why? That thing isn't asking anything of you. You're just mindlessly being entertained. Even commercials are enjoyable. Can you do it all? Well, that stress arises from you trying to do it all. You're struggling with conflict. Now this, honestly, I think is probably one of the most important slides. And this comes from the Stress Center over in Brookline, Massachusetts. Now what happens here, if you look here, this is you going along in your day. You have a stressor, whatever that is. You define what it is. Something happens in your day. Your adrenaline glands, you put out the hormones. So your heart rate escalates, your ability to think because you've oxygenated your brain so you can think a little clearer, you've got a cold or whatever happens. Patient gets violent even, yells, pulling out the IV tube. All right, now you have to handle that stress. Now what happens? The stress level lowers because the incident has occurred and it's taken care of. Something else happens in the day, occurs again. So your adrenal glands are putting it out again. The hormones get shot out again. The brain oxygenates, etc. That whole cycle repeats over and over to stress. So what this lower level here shows you is this is a person who can modulate their stress. They're doing quite well here. So it happens again and they bring it down. This here is the baseline. This here is the process of reaching homeostasis, which is balance. So your allostasis is when you're increasing your set point, your allostatic load. What this person's experiencing the same thing, so they have a sharp rise in the stress level. And see this? They never fully come back down to baseline. So then it happens again, just like the lower line here, and it goes up, and see where they're coming? So look at this line, never really comes back down to, never comes back down to this line, which has elevated from this line. So during the day, you're increasing your allostatic load. You know what this means? Eventually, people can develop high blood pressure. We don't exercise a lot. We sit a lot now because of computers. So just think about your day. I just want you to think about your day. So your set point of stress is increasing. The other thing we do is we load ourselves up on caffeine. However you take it. A new norm is we have just got to adjust to everything. Learning how to do it all means everything is new. The COVID epidemic changed our lives. It changed everybody. But think about what happened to the nursing profession. If you work in substance use disorders, in the clinical field of what we do, not addressing the stress and the residue that sits on us, you can get that numbing, that constant psychic numbing. And one example, when I see people out there Narcaning, and they can be carrying bags of Narcan in order to reverse an overdose. One firefighter I was talking to one time on the street with students, he was telling me he saw the same client repeatedly during the day. And I said to him, quote, "How do you deal with that, Joe?" And he said, "I don't." I mean, that's a pretty profound statement. He tries to just walk away. And what he said to all of us, he wanted the students to know, is that his weight was increasing because he was eating so much. The core impact of constant stress in our lives, you can have any of these, or a few of them, or all of them. But if you have more than 2, 3, you're struggling with something. And you can be angry at what? The God of your understanding down here, whatever you believe God to be. When I was called for the Boston Marathon bombing, my boss wouldn't let me go because I was too angry at God. God, how do you kill a little boy? He's 8 years old. And my boss just tapped me and she said, "Come here, you. God didn't kill that little boy. A terrorist did." And it took me a long time to resolve that because I was just angry. You can feel overwhelmed. You can have accidents. You can be banging into things. You're dropping stuff. You're losing things. Where's the pen? I put my pen down here somewhere. You don't know where stuff is because you're scattered. You can be moody, you can have that regressive thoughts, pullback, changes in intimacy. Your loved one at home just wants to be intimate with you. And you're just like, leave me alone. I just want to sleep. Intolerant of others. Sleep, you just don't sleep well. The average American sleeps 5 hours a night. The brain takes 8 hours to heal. If you don't sleep 8 hours, and I can count on one hand the people that I know that do, your brain is not fully healing. And let me tell you right now, the brain cannot multitask. You know how people pride themselves on being able to multitask? And when they go into an interview, they'll tell the manager, "I'm really good at multitasking." I have tried to teach managers that that's not healthy. You don't want someone to do that because you're going to make mistakes. And we work with precision, medication, IVs, how we program monitors, that's precision. Appetite changes, you eat more, you eat less. I've never eaten less when I'm stressed, but people do. Nightmares, that isn't, monsters. That's I didn't do enough. It'll wake you right up out of a sound sleep. Use of negative coping. Eating more, sex more, technology more. Now, you're all nurses. I don't need to go into this, but you have the sympathetic nerve system in the brain and the nervous system, that sympathetic branch, and the parasympathetic. So you get that fight or flight. That's that line and the allostatic load that we're increasing. And then the parasympathetic brings you back down. That's the rest and digest. I won't go into too much of this. Prolonged stress, this is what happens to us. Everything becomes a problem. You can get that self-neglect, anhedonias. I just don't enjoy anything. You loved your work. What happened? Your ability to bounce back. That's what resiliency is. You just can't do it. You become angry at the God of your understanding. The burnout effect, you can do anything, but you just can't do everything. And this one woman wrote in this whole article, "There's a name for this?" Yes, there's a name for it. Compassion, fatigue, and stress. It's not burnout. Burnout, you can go on a vacation and get renewed and come back and rejuvenated. Compassion, fatigue, and stress, that goes with you on your vacation. You come back and you never feel fully. You're worrying about stuff wherever you went. This is one of Dr. Figley's model. So this should be empathetic, not empathic. But empathetic means it's who you are. It's caring for humanity. You have that response where you care. Detachment means you get in your car at the end of the day, you turn the ignition, the next thing you know, you're home. You don't remember driving. You don't remember being on the road, red lights, green light. You're just detaching or trying to for the day. What can happen here is residual compassion stress means something of the day stays with you. Prolonged exposure to suffering, that can be months, that can be over 2 years. If we had time, and if I said to any one of you, tell me what happened to you, give me an incident in your career, you would name the date, you remember the patient's name, you remember what happened, because it's affected you, and we are not a profession that is taught to process. I'll tell you who is. Social workers, psychologists, licensed mental health counselors, addiction counselors. They're the therapy-based professions. We're the medical base. The doctors, the nurse practitioners, PAs, nurses, pharmacists. All of us are running with the wolves. So we don't slow down. It's buck up, shut up, and keep moving. The COVID brain, these two are two doctors at Boston Medical Center that during the COVID crisis, they just kept feeling like all they were doing was apologizing, and then they would get shot with their coworkers and with each other, and then they were apologizing. This is happening so much. Some of the nurses that contacted me from this hospital find this is what's happening. They don't know why their behavior is changing. It's that transformational worldview. It's knowing the difference between joy and happiness. It's being joyful with who you are as a nurse. Happiness is different. And you get all these different, definitions. Joy comes in ordinary moments. Just one little thing that you can remember of the day. And I'll show you one of the ways that a chaplain here in Boston, who works in the Dana-Farber, which is a cancer center, teaches people to renew their joy every day. The way I define all this in the clarification is happiness is I won the lottery. Joy is I didn't, and I'm okay. Joy comes from within. It's a byproduct of a moral lifestyle, of feeling good about yourself. I don't mean morality, who defines good and bad, but it's being okay with your inner core of who you are. Your work is with people. If you think that you can be immersed in suffering and loss daily and not be touched by it, that's about the same as thinking that you can walk through water without getting wet. It's going to touch you, this type of work. And I don't think we teach students enough. There's a couple of areas of clinical practice we're not real good at teaching students. Addictive disorders, 1, pain management, and self-care. So we change the world when we meet the needs of another. The Hindu people, the ancients, believed that taking care of, there is no greater, more noble profession than taking care of another human being. Contagion theory. You ever get around someone who's really anxious and you can pick up on it and you start feeling yourself like you're really anxious? If you're standing near them or sitting, you can find yourself even leaning towards them. When they're anxious, you can start picking up on their anxiety. And what that can do is create here, guys, it's called anticipatory anxiety. Like, what the hell is that? It's that I'm feeling anxious that I'm going to be anxious. So what are the issues? All of these. Diminished interaction because you're pulling back. You begin to be judgmental, that black and white, everything's good or bad. You can use chemicals or behaviors for stress. Think about how much now you hear people say in the workplace, oh, I can't wait to get home and have a glass of wine. Maybe not us, but think about how often that is said. How the breweries and everything has just burst off the scene these days. What's happening at home? Your family, your loved ones just kind of understand sometimes what's different about you. And they say things to you like, you really got to get another job. You're awful when you come home, things like that. And you may demonstrate those physical symptoms. Here are your ethical principles. Do no harm, do good. Well, how about do no harm to yourself? Put yourself first. If you walk away with nothing from me, learn how to put yourself first. Yes, we're taught to care for everybody. Okay, but what about us? Who takes care of us? Honestly, nobody, unless we take care of ourselves. If you're feeling that you've noticed you have a little judgmental behavior, take a look at your average day. That's why I asked that question up front. Are you using just more chemicals? Coffee. I worked with a nurse, he worked nights. He used to drink 6 of those cans that had the extra boost in them of caffeine and coffee. And I said to him one day, doesn't your heart feel like it's jumping out of its chest? And I know caffeine in the research has been shown that it's pretty good for your brain now. But seriously, how much? How many milligrams can the body tolerate? I won't get into this. You react. This is what you look like when you're stressed. You look like a cat ready for battle. It's that primal area. It's the inner brain that's ready. The great poet said this, too long a sacrifice. It's going to give you that heart of stone. That's that psychic numbing when you just can't shut it off anymore. So a wonderful social worker that I worked with said, we have to find the way to care about ourselves as much as we care about others. I'll skip over some of this. Think about this. When the only tool you have in your box is a hammer, everybody's going to look like a nail. You're going to get frustrated. But when you feel better about yourself or you're taking care of yourself, it's a world of difference. And let me say a couple of things. One, I would not tell you to do anything I don't do myself. That would be disingenuous of me. I know I'm rushing through this, but I do practice these myself. Second, everything I'm going to tell you is free and there's no copay unless you go to the bookstore and you buy, one of these, which is these cute little mindful. I'm always scrounging looking for new stuff, but they're pretty much repetitive. How are you going to fix everything? Well, you need certain tools. So what are you going to have in your tool bag? That's the new buzzword. First of all, you need 15 minutes of silence a day. Everybody says to me when I do these trainings, all day trainings, etc., I don't have 15 minutes. Yes, you do. And if you don't find it, you have 15 minutes. You just have to block it out for yourself. Even 5 minutes, 5-minute sections are good. But try to get 10 to 15 minutes. 15 minutes is preferable to just be silent. How do you think this character created all those geometric principles a bazillion years ago? This is mindfulness. We're touting this term everywhere these days, but you know what mindfulness really is? It just means paying attention to yourself, listening to your own words when they're coming out of your mouth. Is your mouth dry? Are you sweating more? Being present, being in the moment, intentionally being aware of yourself. And when you, for lack of a better term, guys, screw up or make mistakes, be non-judgmental and say, I can't believe I did this, or apologize, or make amends somehow, as we say in recovery. So mindfulness, utilize it as if your life depended on it, because it does. And mindfulness is free. The Art and Science, John Kabat-Zinn, in 1994 said this: we are performing like human doings instead of beings. Mindfulness teaches you to just put down the juggling balls and stop. Meditation. Now, meditation doesn't mean I'm sitting in the corner here, I can do that. But meditation may be as simple, and if we had more time, I would show you to just sit back in your chair, wherever you are, office, or if you're at the clinical station, wherever you are, take a minute, take 2 minutes, and just slow it down. Bring your heart rate down. Breathe. Meditate means focusing on a positive quality. It doesn't mean I have to sit in the sand. It can just mean that I'm focusing on an image, a word, or a phrase, and it slows all the racing down. Is it good stuff? It's absolutely. Research shows that MRIs show that the cerebral cortex thickens as a result of regular meditation. I mean, really, it's the only thing we want to stay thick as we age. The relaxation response, learn to breathe. Now, you can find them on YouTube, you can go to sessions, you can just sit back in your chair and breathe. And there's 4x4, which means you breathe in 1, 2, 3, 4, hold it 4 seconds, out 4, count 4, or you can just close your eyes and breathe. You can do unstructured breathing, which means you take a deep breath in 1, 2, 3, pause, out 4, 5. And about the 5th or 6th breath, bring it out to 4, 5, 6, and pull out that breath. And the other thing is called soft belly, where you just relax. You just sort of chill out and let it go instead of holding together constantly. So the thing that this does is learning to breathe. You inhale and you'll feel your diaphragm expand, and then you exhale. And do you see what's showing here is the exhaling shows that it feels like your stomach, it goes flatter. And I would say find a special place to do this. 15 minutes if you can. Do not do it when you are operating machinery, and never do it while you're driving, because you can get a little dizzy. And what that dizziness does is just slow you down just a little bit. I'm going to skip over some of this. 6 happiness habits that you want to cultivate. Pay attention to yourself, that non-judgmental. Keep friends close. Give thanks. Drop the grudges. Get moving. A study by the Mayo Clinic says 20 minutes a day. And it's another thing I hear, oh, I don't have 20 minutes. But you have 5 minutes at a time. If they all equal up to 15 to 20 minutes a day, it's just as good. They studied 400 participants. And the benefits to interactive time, like 5 minutes at a time, if it equals up to about 20 minutes, it's just as beneficial. The other thing I want to say here is practice kindness. If you are seeing one of us struggle, one of your coworkers, just stop and just say, tough patient, I know you're doing a good job. Stop for the cleaning lady. You did a really good job in room 5. That was an awful room. Somebody who brings up the food, make an effort. You will feel different. You will feel just a brief endorphin rush with that. I know I sound off the walls with this, but it's true. When you're waiting in line somewhere, particularly at the supermarket, Jean Watson taught me. When she came to Boston, Jean taught a lot of us these techniques. When you're waiting in line, stop. When someone gets in front of you and it's the 12-item line and they got 25 things and you're furious, just stop. Use that extra time to just stand there and just meditate, chill, move along slowly. And I know the kids are waiting for you at home. They're going to be there. They can wait 2 more minutes. More mindfulness techniques, the texture of the food and colors before you dive into your food. And I see this all the time in the hospitals I'm in. People are racing to get there, and they've got what? Their phone, they're eating, tweeting and eating, I call it. When you are tweeting and eating, you are not relaxed. Before you eat, stop and look for seconds at the color of the food and the textures. I'm teaching my grandson this one, how to slow down while he eats. If you practice these, it helps lessen that monkey mind where you flight of ideas. You're just like, oh, I got to write that down. Now you got little stickies everywhere and lists of stuff that you have to do. Part of that is monkey mind. You're just jumping all over the place. If you learn to temper all of that, look what it does. It leads to efficient learning. you want this to be you. You want to be more creative, and you want to improve your concentration. I love this. Mindfulness. We have a belief system very often that mindfulness is this just fluffiness. So I don't have time for that. If you learn to do it, I love this. It's like a Hummer without the gas guzzling. And it can get you over rough terrain. It can get you through those codes and those tough days and meetings with staff or administrators or whatever that's tough. In the morning, when you get up, just sit there for 15 seconds on the side of your bed. You sit up and you just say, I'm good at what I do, and I will do my best today. Take a couple of breaths. During the day, when all hell is breaking loose, just stop. Today is difficult, but I helped one family, or whatever I did, you listed. I enjoyed that. I can finish the day, a couple of breaths. At night, just before you're getting ready for bed, just sit there again. I did my best. I did everything I could. I'm not perfect, but I'm good at what I do, and I will rest now. Seems so simple, doesn't it? It is. You just have to do it. All right, I'm going to skip over some of this. Learn to cultivate satisfaction, the pleasure of what you derive from being able to do your work well. Be mindful of that and stop the ants. ANT means automatic negative thinking. Oh, I should have done better. I never do it right. I always miss whatever. Get rid of those out of your vernacular. You're good at what you do. Just remember it and tell people around you and start, what happens if you do that? It like creates a huddle like firefighters do. You may not be able to change the stress in your world, but you can change the way you react to it. So this is what I was telling you about. This is from the chaplain. Set aside 5 minutes every morning for reading, meditation, reflection. 5 minutes. Read 5 pages a day that's uplifting. And it doesn't have to all be at once. Page here, page there. Stop. Carry something with you if you have to. Count one blessing in the day and perform one act of goodness or kindness. It's simple. And there's no cost to any of this. There's a head of a program. She's a professor of law. She found her legal students were getting just as off the charts as us. She created the STOP program. Stop what you're doing, take conscious breaths, observe your TES, your thoughts, sensations, and emotions. Scan what's going on with you, that whole mindfulness slide, remember that? And then proceed slowly with kindness and be non-judgmental to yourself. Social media can be a problem. Limit it or get rid of it for a while. Negativity can breed negativity. Eliminate toxic thoughts and gossip. Get private time on a daily basis, 15 minutes. Recognize your own body rhythm. Stop. If you feel like your heart is jumping out of your chest, something's happening to you. Be mindful. Eat well. I'm no professor of nutrition here. I was almost 300 pounds, but I had to learn to exercise and eat correctly. Your phone apps, you can get free ones on your phone and you use them. And when it's stressful during the day, you take the phone and you do the app, and there's one for the brain. It's like a labyrinth that you trace. And what you find is if you do that, it lowers your heart rate. They're free. When you have to pay for them, get rid of it and get another free one. Find a quiet space somewhere. A lot of hospitals are now putting in quiet and safe and sacred spaces for us. If you work in an agency or a clinic or a university, find a place or create it. Laugh and giggle when you can. Pet a furry, if it's a furry creature or whatever, that helps you relax. Put your feet up and legs up and be still. Stop. Music, if it's not distracting. Learn to gulp, not gulp food. Have a hobby. Do you have a hobby? I wish I had more time to peruse. I'd guess 10% of you listening to this have a hobby. Now, I haven't had a hobby. I used to, had many. But with the stress I have these days, I don't know if you can see it. I picked back up my guitar because I need to get back to doing what's best for me. The rule of 15 minutes, phone apps for mindfulness techniques, emotional personal protective equipment. What do you got? Who's in your life you can call? Go to somebody in your area that you trust and you can say, Suzanne, can you listen to me for just a minute? And then what's Suzanne going to say? Oh, yeah, sure. What's wrong? And then I tell her, oh, no. Now it becomes a we problem. What you have to say is, give them permission to just listen. Suzanne, you don't have to do anything. Just listen to me. That's all. And then it's like, oh, okay, I can do that. That lightens the burden on both of you. In contact with family and friends, guys, the ones you like, not the ones who irritate the hell out of you. Why are you going to spend time with them? Create just that take 5 room, yoga, exercise, tapping, do whatever. Look up these in the world of self-help and holistic care. Does tapping work? It does. There's not a lot of research to support it, but you tap your bones, your wrists. It does work. Take breaks. Encourage verbal expressions to debrief. We did that. The price of anything is the amount of life that you exchange for it. Don't let your life be you. Create your own contract. What that means is take a piece of paper, just a regular piece of paper, put your name on it, your date, and put 2 things you want to change and improve on. It takes 6 months for your brain to retrain itself out of a bad habit into something new and positive. What do they tell you on a plane, guys? Put the oxygen on yourself before you start taking care of other people. All right. Physical activity. Dr. Amen, psychiatrist, says it's the best thing you can do. Now, I want to just stop sharing for a minute, and I'm going to go probably to the end of the screen and just show you just a couple of things for a minute, and then we'll do just some questions. Slideshow. Okay, it didn't work. All right, be prepared for difficult times. You're going to have them. It's what we do in life. Who's on your team? What's your emotional? If you need therapy, sign up. I think the world should be in therapy, but not everybody thinks that way. I do. Okay. Here's that study I was telling you about. It's at the Mayo Clinic about exercise. Here's some simple ways to relieve stress. This is my favorite. Avoid tight-fitting clothes. Don't rely on your memory. Just, if you need to, write things down. If you ever said, oh, I'll remember that, and you don't, then you're hitting yourself that you don't, and the ants, the automatic negative thinking starts. You ever lose your keys or your phone? Your world changes. Say no more often. Anticipate your own needs. That should be first. I should put that first. Here's a groove. Me and my students, we went around in hospitals teaching nurses to get up. Look at this guy. You think he's going to have his back's going to hurt tonight? All right. Huddle time, that comes from first responders and firefighters. We need huddles. We don't do it real well. Which is more important, the journey or the destination? It's the company. It's us. It's who we are. I'm going to skip over some of these. Is religion a source for you? Learn to be silent. Remember him again? Look at this guy. What do you see? Pure relaxation. No technology. None. Just hanging loose. Small stuff. Ask for help. Listen to your own advice. And when the first words out of your mouth are, I'm just too busy, that's when you need it the most. Now, I know this guy's a little controversial these days, but some of the things he has said in his books, Dr. Seuss, are phenomenal. This is one of them. You have brains in your head, feet in your shoes. You steer yourself in any direction you choose, not me. Take a mindful minute. It intensifies your confidence, your well-being, etc. Learn, I don't know if you're aware of this term, deobligate. You know what that means? Say no. So when everybody's calling on you and, the church wants you to take over some committee, no, I can't, thanks. Maybe next year. Self-care, you don't have to do all of them. Just pick a few things that might help. Declutter. Who's giving you this advice? I mean, take a look at this. But I'm going to feel real good because I cleaned up what was all down here. So I got to get rid of that. Reminder, when you're doing any of these on the left, go to the right. If you're anxious and your heart's beating out of your chest, take a deep breath, get that heart rate down, and then try to slow it down and do some meditation. And again, meditation is focusing on a word or an image or a phrase. When you're stressed, maybe walking helps. I love this quote. This is us. Where your talents and the needs of the world cross lies your calling. And if you're wondering why I love quotes, quotes are part of poetry. And poetry reaches that creative side of your brain because we are so linear. We have to be precise. I'm going to leave you with this and then we'll do questions. A group of students, this is a true story. My daughter who teaches children who are deaf, it's not her story, but it came to me. The teacher asked the little kids, these are second graders, to list what the 7 wonders of the world are. Do you know them? Well, I got the Taj Mahal and the pyramids and I was done. Okay, look at these little second graders. Did you even know there was a Great Wall of China in the second grade? Look how bright these kids are. One little girl was having trouble, so the teacher asked her, what's wrong? And she said, well, there's just so many. I'm having trouble trying to decide. So the teacher said, tell us what you have and maybe we can help. Little girl stood up and said, I think the 7 wonders of the world are. Now you just read these. This is coming from a second grader. Think about this now. When little second graders standing there saying those 7 things. The teacher was so moved that a small child was able to identify what you and I take for granted every day. Things that are simple and ordinary often surround us, but you're so busy, you lose sight of the wonder. And what you leave behind is not what is engraved in monuments, it's what's in the lives of others. Haven't you seen some of your patients and they say, hey, friend, do you remember me? You are in their lives. They're in yours, but you have made an impact, and that's who we are. So it's our job to support each other in our caregiving. And Carl Jung, the psychiatrist, said this, because this is what you do every day. You touch the miracle of a human being. So with that, I do work with a man who was an Apache, and I volunteer on the Apache reservation. I couldn't in COVID. But this is Joseph's blessing for all of you. And it's always so moving to me. And the last line is, may you walk gently through the world and know its beauty all the days of your life. Now with that, my friends, let's see if anybody actually has any questions. What we got here? Let's see. Dr. Wiley told us you have to make time to have sex with that person you love. Sex is an energy exchange. To this, I remember those words. You know, who said this? I can't really even see it. The thing I try to use is the word intimacy because it has a different connotation to it. That's all. But there is truly an energy, and a sexual encounter with someone you love is true intimacy. I don't know about that. I'm Irish. We don't get into it. Do we have something else? Anybody else want to say anything or? No? It's a quiet group.
I remember when I was doing my dissertation, my committee chair told me I need to make time to putter. And I looked at her like she was crazy. I said, I don't have time to do what you want me to do for this. How am I supposed to make time to putter? And she said, you go home and you take 10 minutes to putter every day and come back and tell me that you did. And that's kind of like what you're saying. And it really
It is.
works. It works. I
It is.
sat
And
out in my backyard and I looked at my yard and the birds and the flowers, and I had 10 minutes of peace.
but you know what happens, Suzanne, is when someone says, I'm going to go out and sit in my backyard, and you've had like a wild day, you go out and sit in the yard and you feel like you're supposed to be doing something. I should clean up,
It
or I
takes
should
a
rake.
while.
Or, yeah, it does. And you learn to do it. Oh, I see this quote now. I like that word, putter. I'm going to use that. So Kay Wiley was the nursing professor. All right. Suzanne, was this what you wanted, Suzanne? Okay. All right. I think if any of you have questions, you will see I can pull it back up. My PowerPoint has a little bit on it that I'm going to send to Robert, because I can't give everything away, but I can give some of the things away that I have pulled and gleaned. But my email address is on there. If you ever have thoughts or questions or something doesn't make sense to you, don't ever hesitate, to get back to me. And I'm going to maybe just pull up. Who's this from? Anita, you're going to share it with your students? Anita, are you in Northeastern?
Anita's in Ohio.
Oh, okay. Somebody told me they were in Northeastern. Let me just pull it back up and we'll go from the current slide. I have to pull this down. I'm not sure why it does this. This is my email address here. If you ever want to get in touch with me again. Can you all see this? Is it on there?
Yeah,
Okay.
thanks.
dwight@prnassociates.org. And the other person you might want to be aware of is Dr. Charles Figley. Dr. Figley, Charles Figley, and Jean Watson are the two people that I studied with in graduate school. Everything, I would send everything to Charles Figley. And Jean Watson, when I met her, she just went through all of my work. And everybody has a nursing theorist. I never believed in nursing theory, guys. I always thought it was a bunch of hooey. I thought, who has time to define a theory for nursing? We're all too busy. Until I met Jean Watson and until I read her. I mean, I studied them all and I said, oh yeah, okay, this is great. And then Jean Watson hit me like a hurricane. And I think that's what happens when you find a nursing theorist that makes sense to you. Like her work about caring, the Caritas, it's called the Caritas theory, because that's what we all do in addictions, studying and learning substance use disorders. When you work with the poor or the homeless or the rich, or it doesn't matter where you work, when you see people struggle like this, that caring is innate to who we are. So blending Dr. Figley and Dr. Watson just made all the sense in the world to me. It's 8 o'clock. I have 8 o'clock. Does anybody else have any thoughts? No, you got something else? Please take these to nursing students, because they're not they just don't hear it enough. They don't hear how to take care of themselves. They're not taught. Non-existent, boy, is this true in the emergency room. How to approach this. Kindness is the question. Stop. When I went back, I was in a psych hospital and I went back to the emergency room to prove I could do it, I guess. I don't know what the hell it was, but I had to prove that I could do it. And I found there was an incredible amount of trauma. Not with the patients. We expect that. It was with each other. And that's called secondary traumatic stress. We are just absorbing the stress that we see, whether it's biological, physical, but emotional trauma. And it just sits in there unresolved. So try to get some supervision, even if it's 5 minutes. Go to your colleague that you trust, not someone you don't trust, because it won't help. Go to someone you trust and just say, can I please? And give them permission to just listen. Okay, somebody else got a thought? New message, it
A lot of
says.
thank yous. A lot of thank yous.
Oh, Charlene Berger is on here. Charlene, where are you? wave your hand. She is a nurse manager and an ED. ED is the correct term now, right, Charlene?
Yes, it's ED.
Yes. Well, I was corrected in Washington, D.C. by a little emergency room nurse. She was about 5'1", and she stood up and she said, "Excuse me, I don't go by Dr. White. I'm Donna." And she said, "Excuse me, Dr. White. We're not ER nurses, we're ED nurses." And I said, "Oh, okay. ED to me is erectile dysfunction, but you can be anything you want to be with me." Okay. I was like, whoa.
Well, see, they're a department, not a room.
Yeah. Didn't I learn? We all learn. And it was, you have to be able to learn. And some of those millennials teach me every day. I just want you to know this. Millennials, as we leave, they are the least racist, the least bigoted, and the most community-oriented of all the age brackets. What's bad about that? Okay, my friends, you're a joy. Email me if you need me.
Thank you.
You get 1 credit for this,
Thank
I guess,
you.
right?
Yes.
Bye,
thanks.
everybody.
Bye-bye.
Bye-bye.
See you all next month.